post-operative instructions for dental implants. So you need to be aware when you have a dental implant that expects a minor bleeding. Minor bleeding is perfectly normal, but if it's copious amounts of bleeding, that means there's an issue. That means either the stitches are broken out and you need to come and see the dentist straight away. That way we can close it up. It's minor trickling, that should be sufficient, that's okay. The other thing that can also happen is there's potential for swelling. Post-operative instructions for dental implants. Inside here is also some gauze. So this here is an ice pack. Place it here right on the implant site. And what then happens is it just decreases the swelling in the area. If you had a bone graft and we've raised a flap and we've stretched the periosteum, there'll be a lot of swelling, especially if the surgery is complicated. If it's a simple extraction, there's loss of bone, there'll be minimal swelling at all. In fact, some people will barely notice anything's happened. But if there is a lot of swelling, do expect some swelling if you had a bone graft. The swelling increases in the first 2-3 days, and then afterwards it slowly decreases. It should be fine. The worst case scenario is that if we do an all-on-4 implants and there's a lot of bone grafting, your whole face will be bruised. It'll be a lot of swelling. But in simple cases, single implants, no bone grafting at all, there'll be minimal swelling. In terms of dietary advice, we recommend that you have a soft diet. We don't want hard foods penetrating into any blood clots or cutting any of the sutures that are there. So please have a soft diet. In terms of pain management, there should be, if you have implants, do expect some pain involved there, especially the first 2-3 days. So first 2-3 days, Panadeine Forte, mostly sufficient for most people, but some people, if they have extensive surgery, they may require something a little bit stronger. But Panadeine Forte is the first line of defense. Every single implant case, we will give you a course of antibiotics to help you heal, and heal quicker, and B, so there's less pain and less chance of infection to occur. In terms of oral hygiene, we recommend that you rinse the area with salt water 24 hours afterwards, just to decrease the bacterial load. In the first 24 hours, we don't want you to rinse at all, simply because we want the flaps of skin to connect to each other. In terms of physical activity, we prefer that you keep physical activity to an absolute minimum, because we don't want any increased blood pressure and bleeding to occur.